When you hear OCD, what comes to mind? Maybe it's someone who's super tidy, color codes their closet, or triple checks if the door is locked. But real obsessive-compulsive disorder, or OCD, goes far deeper than neatness or quirky habits. Let's break it down. OCD is a mental health disorder that involves two key parts: obsessions and compulsions. Obsessions are intrusive, unwanted thoughts, images, or urges that cause anxiety or distress. Compulsions are the repetitive behaviors or mental rituals someone feels driven to do in order to reduce that anxiety. Let's look at an example. Imagine someone who has an intense, intrusive fear that they might accidentally harm someone, even though they've never done anything violent. To ease this fear, they might avoid sharp objects, or they might repeat a phrase in their head a certain number of times to neutralize the thought. The obsession is the fear of harming someone. The compulsion is the ritual meant to prevent it. Here's what's important. People with OCD usually know their thoughts are irrational. But the anxiety they feel is so strong that they perform compulsions anyway, often for hours a day. That's why OCD can become debilitating. It's not just about being clean or organized. It can involve fears about germs, but also about morality, harm, religion, symmetry, or even existential questions. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, OCD is diagnosed when obsessions and/or compulsions are time-consuming, usually more than 1 hour per day, cause significant distress, or interfere with daily functioning. So what causes OCD? There's no single answer, but research points to a mix of biological, genetic, and environmental factors. Brain imaging studies have shown that people with OCD often have abnormal activity in a network involving the orbitofrontal cortex, anterior cingulate cortex, and basal ganglia, regions involved in error detection and habit formation. One 2004 study by Saxena and Roch found increased activity in these areas during symptom flare-ups, and that successful treatment, especially with cognitive behavioral therapy, can actually reduce this overactivity. There's also evidence of a genetic link. First-degree relatives of people with OCD are more likely to develop the disorder, and twin studies suggest heritability is moderate. Environmental triggers, like childhood trauma, infections, or stress, may also play a role in onset. So how is OCD treated? The gold standard is cognitive behavioral therapy, particularly a method called exposure and response prevention, or ERP. In ERP, the person is gradually exposed to their feared thought or situation, without performing the compulsion. Over time, this helps retrain the brain to tolerate anxiety and break the obsession-compulsion cycle. Let's say someone has a fear of contamination. In ERP, they might be asked to touch a dirty surface and then not wash their hands. It's tough, but studies show it works. Medication can also help, especially SSRIs, or selective serotonin reuptake inhibitors. These include fluoxetine, Prozac, fluvoxamine, Luvox, and sertraline, Zoloft, which help regulate serotonin levels in the brain. In treatment-resistant cases, newer options like deep brain stimulation or transcranial magnetic stimulation are being explored. Here's something important to remember. OCD is not a personality quirk. It's not about liking things tidy or symmetrical. It's a real disorder that affects about 2% of the population worldwide, often starting in adolescence or early adulthood. And it can be incredibly isolating. Many people with OCD go years without diagnosis because they're ashamed of their thoughts or fear being misunderstood. That's why education matters. When we reduce OCD to stereotypes, we make it harder for people to get help. So if you or someone you know is struggling with intrusive thoughts or compulsive behaviors, don't dismiss it as just a quirk. There's support, there's science, and there's hope. OCD is more than being neat. It's a brain-based condition, and with the right tools, it's treatable.